And what I wanted to ask Ms. Tripoli, if you could talk about what this really means for this vertical integration is doing for Medicare Advantage. And it seems to me that it is contributing to the higher costs that consumers are having to pay.
Thank you so much for the question. So the evidence suggests that MA plans that are vertically integrated are actually more likely to engage in the upcoding, which is the practice that you're referring to that's generating these billions of dollars, multiple billions of dollars of overpayments. And this suggests that plans could actually be putting pressure on the providers that they have vertically integrated, so providers that they own, to increase the intensity of the coding, so to upcode their patients, make them appear more sick than they actually are, so that they can actually get a higher reimbursement, get higher payments from Medicare. So I would say this is, of course, a hugely problematic practice and one that should be scrutinized further.
Thank you. Well, you know, we're also seeing that the care is being sacrificed as well, that we're seeing a lot of people who aren't getting the services that they want. I hear it all the time in my office. Have you seen that?
Yes, well, we're seeing that many Medicare Advantage plans are aggressively marketing to seniors about the supplemental benefits that they could get if they enrolled in their plan. And what we've actually seen in the last couple of years is a huge spike in complaints from seniors saying that what was marketed to me is not actually what I have in this plan. So I think we don't have enough information, enough transparency around what the supplemental benefits are that MA plans are marketing to seniors and actually offering what the value is to consumers, how they're using them. And so I think increased transparency around, in general for Medicare Advantage, but particularly for supplemental benefits would be critical.
So I did want to say that private equity has become a major player when it comes to healthcare systems. And we know that 600% increase in private equity being involved in physician practices, and then we also see that 400 hospitals right now are now private equity. And so I also wanted to ask you, Ms. Tripoli, in your testimony that you talked about transparency is very, very important. I actually have a bill that would require these companies to divulge themselves. And I wanted to see if you could explain how private equity ownership may also interfere with health costs and maybe health outcomes.
Absolutely. I think we have to generally be very skeptical of private equity mergers and acquisitions in healthcare. The data that we do have suggests that quality does go down and prices go up, higher fall rates, more hospital-acquired conditions when private equity has come in and acquired a hospital system. In general, we have a lot of opaqueness around the change of ownership among private equity when they're doing mergers and acquisitions. So having more transparency around that level of information would be really important to better understand the trends in the market and actually would help to facilitate federal and state investigators to scrutinize private equity mergers and acquisitions in healthcare.